All right. Welcome, everybody. Good to see you all today. Before we get started, I'm going to introduce Consuelo, who will be doing the Spanish interpretation for the meeting today. Go ahead, Consuelo.
Ok, muy buenas tardes a todos, bienvenidos. Antes de iniciar, voy a presentar a Consuelo, que va a ser nuestra intérprete de español, y ella les va a explicar ahorita las instrucciones de la interpretación. Van ustedes a ver en la parte de abajo un símbolo que es como un globo terráqueo. Ahí le van a apretar y dice Interpretation. De allí, el siguiente paso es que van a elegir en el menú, van a ver un menú que diga inglés y español. Tienen que elegir español. Si usted prefiere escuchar solamente español, también dele clic a donde dice Mute Original Audio. Si eligen inglés, en automático van a escuchar únicamente inglés y ya con eso van a poder escuchar la interpretación de la reunión en español. Muchas gracias. Thank you very much.
Thanks so much for supporting us again this week, Consuelo.
My pleasure.
And welcome. Yeah. Welcome, everybody who is joining that we can't see your face if you're joining online as the general public. I just want to remind you that this is an open meeting, but the pictures on the screen are only for the people who are participating in the Colorado Ag Behavioral Health Working Group. If you're joining us as the general public, there is a Q&A button at the bottom, and if you have questions, feel free to enter in questions or comments throughout the conference or throughout the meeting. If they're important questions that need to be answered in the moment, we have folks that'll be watching those Q&As. Otherwise, we'll make time at the end to try and address the Q&As with people from the panel. So thanks for joining us today. And for those of you who are on the working group, if you don't have the agenda, you can pull it up. Rosie sent it out in an email earlier. One last thing to say is that written comments from folks that are watching are available anytime during this, or you can reach out to people through the Ag Behavioral Health website and submit comments there as well. Robert, am I missing anything for that introduction for the folks who are joining us online?
Good. Thank you, Clinton.
Awesome. And then I think that last time we talked about just doing a super quick check-in at the beginning to reintroduce ourselves to the people who are watching, and just so that we can get to know each other's names. We're going to do who you are, where you're from, what you represent, and if you have a recent success that you just experienced that you want to share, take 30 seconds or a minute to share that with us. So my name is Clinton Wilson. I work for Colorado State University and the Colorado Agribility Project. I live in Fort Collins, and a recent success for me, we had I raise dairy goats and hair sheep, and we had a goat go into labor 2 weeks early this past Thursday, and she ended up giving birth to 3 kids. Only one of them survived with the 2 weeks early, but the one that did survive, we were afraid she wasn't going to make it. She wasn't able to stand on her own. We were taking her to her mom every 2 hours to help her nurse. We're not really into raising bottle-fed babies, so we didn't want to invest for the whole next 4 to 6 weeks of feeding this kid. And on Sunday, she stood up on her own. She was able to nurse on her own, and so we're hoping to move her out to the farm. So it seemed like a big success that we gave this kid a lot of love, and her mom has responded and stuck in there like a champ. So I'll pass it over to JC.
Good afternoon, JC Carica, Vice President of Valley-Wide Health Systems. We are a federally qualified health center and a community mental health center. So we do primary care, physical therapy, and behavioral health, as well as dental across Southeast and South Central Colorado. And I guess the success is that the Coffee Break Project is still continuing, and we're still traveling about. And both of our advisory committees are thriving, one in the Lower Arkansas Valley Ag Advisory Committee and one in the San Luis Valley Ag Advisory Committee. And we are in the process for 2025-26 of updating our partnership logos that are supporting our work. And the CDA was one of the first ones to respond and said, throw us on there. as well as Agribility and CSU Extension. So we always appreciate those partners and looking for others. Thank you, Clinton.
Yep. You want to pass it on to somebody?
Sure, I'll pass it to Chad.
Thank you, JC. I'm Chad Resdenchek. I'm the Behavioral Health State Specialist with Colorado State University Extension and the Colorado Agribility Project. And I will wait to save one of our successes for a little bit later. So I would love to pass it off to, let's say, Kate.
Good afternoon, everyone. I'm Kate Martinez with San Luis Valley Behavioral Health Group. We're a behavioral health entity representing the San Luis Valley. I myself live in Del Norte, Colorado, one of the rural spots in the San Luis Valley. One of our recent wins as an entity would be that we're getting ready to launch some really exciting May Mental Health Month initiatives. We're going to do some Chalk the Walks with local partners. We're also going to do some mindful walking talks. So we're going to walk some trails here locally in the valley with some of our peer specialists and open it up to the community. So if anybody wants to join, there'll be more information forthcoming here shortly. We're also going to do some fun initiatives just for our staff to support our own mental wellness here for our clinicians. So we're really excited about those things and excited to raise some awareness about May being Mental Health Month. Thank you all. I'll pass it on to Jacob.
Thanks. I'm Jacob Walter. I'm the Associate Director of Statewide Initiatives and Outreach at CSU Pueblo. And on this committee, kind of from a producer standpoint and a family with, some experience. One of one of the most recent successes, I would say, is Cultivating Colorado is doing an article around rural mental health in partnership with CDA, I believe. And so that I think that's going to be coming out here pretty soon. And then I'll pass on. I'm sorry again for being a couple minutes late. Tim, have you got?
No, I haven't. I hope you guys can hear me okay. Good. My name is Tim Miller. I am the State Affairs Director for the Colorado Farm Bureau. I'm down at the Capitol regularly for another week and a half-ish, like that. Can't come soon enough. But one, and I haven't talked about this with the group, but I do have a success. So a program that Farm Bureau administers with Colorado with Agribility that Chad is very familiar with. We call it the CAMP program. It's a program that provides 6 free vouchers for rural farmers and folks who might not have the access or resources that they need to see an agricultural friendly therapist. Well, in any event, this was on the chopping block in the state budget. And I'm happy to report that this actually got saved. It was 50 grand that was being proposed to be cut by the Office of Behavioral Health. And I had a conversation with Representative Dusty Johnson about this a few months back, actually. And, Chad will remember I reached out to him and he gave me a lot of information about the success of the program, and I shared that with Dusty. And when the time came on the House floor, and she didn't tell me she was going to do this, but when the time came on the House floor, she stepped up and I guess you can say, I'll just say, killed the repeal of the program. That's probably, if that makes any sense. So, so that program is going to get funded for at least the next 2 years. And Representative Johnson also told me that she is hoping to introduce legislation next year that would make the funding for this program permanent. So we're excited about that. Yeah, it was a good win. One that I didn't see coming, but a good thing. And so camp will remain in place. So yeah. And I will offer, we can talk about that program perhaps with this group down the road. I didn't want to necessarily offer it because I didn't know if it was going to be around. So for another day. But So I'm going through the group here, and I will pass it along to Isabella.
Hi, everyone. I'm Isabella Proctor. I'm located in Rocky Ford, representing farm workers. And a recent success is today on our farm, we're planting cantaloupe. And I'll pass it to Michael.
Hi, my name is Mike. I am the co-founder of Warhorse Ranch in Steamboat Springs. We offer equine therapy for veterans, first responders, and anybody with mental health issues. Also, we work with the autism programs in Steamboat. And a success recently was every month the Foundry comes out. The Foundry is a second step to the after they get out of detox, they go to a house here in Steamboat, and they live there for a few months. And with that, they come here and they do some service work, but mostly they come here for the equine therapy and for where we are located. It's a real big success. We had 15 people over, and it's very impactful to watch somebody that came a few months ago and then how they are now and how they have applied the tools that they've learned, and passing it on to other people. Also, well, yeah, it's spring now, so my hives made it through winter, all except 4. So we're getting nucleuses from one of my friends that does beekeeping. He's a fellow veteran. So we're expanding our program. Reps, they help out with the suicide here. They have their beehive. Rocky Mountain Youth Corps is coming out. They're going to be here for 10 weeks straight doing service work. And they're going to be, we're going to introduce them to the equine therapy and how the horses are good for humans. And we're, with the bees, we actually got, they usually eat all their honey, but when I open up the hives, there's some honey that they gave us. So they're going to continue to build that honey, and we're going to sell it in the Ag Alliance here, and the proceeds will go to Warhorse Ranch. And this was kind of a tough month for us. It's twofold. One for me and a few of my veteran friends. It's a trigger month, but we've found support just by talking with each other, having people coming out here. Also, let's see, there's something else. Oh, we lost a horse yesterday, unfortunately. But he was 27 years old. We took him in, and he was one of our vets horses that was, alone, and he had been in a trailer accident. So he came over here, and his name was Sully, and he was an awesome horse, but he was 27, and he was an Arabian. So the horses got out, and he I think he wanted to do his last run. So after that, they came back, and he had a brain bleed apparently. And there was a lot of issues from the trailer accident. So that was pretty tough yesterday, because it takes pretty much a full day to bury a horse. So it took a lot of energy from us, but we're back on track, and we're getting our fencing working on, and people just come out to help that are struggling, and they just like to be out here. So thanks. I'll pass it on to, let's see who hasn't gone. Richard?
Oh, can you hear me?
We can.
Yeah, I'm Richard. I work with the Ute Mountain Tribe down here in Southwest Colorado. I just got on the chat, so I'm not exactly sure what
We're just
should be
introducing
talking
ourselves,
about.
Richard. We're just introducing ourselves. And are you sitting in for Mike today?
I don't know, Mike. There's the Southern Ute Tribe, but I'm Ute Mountain.
Okay, excellent. Okay, well, we're happy that you're able to join. I wasn't aware that you were joining us. So if you want to just introduce yourself a little bit more, saying why that you're joining the group, and if there was a recent success down in your neck of the woods that you wanted to share with the group, take a minute or two to introduce yourself, and then a quick success. Happy you're here.
Well, thanks. I'm happy to be here. Yeah, my name's Richard Harland. I'm the counselor down here for the Ute Mountain Tribe. So I work with the mental health small agency we have here. We're trying to build up the program. Look at needs in our area and how we might be able to meet those needs. We have a huge farm and ranch program here on the reservation. I don't have any real statistics on that. I wish maybe I'll let you know in the future, just like how many active acres they're farming here on the mountain. But we have extensive farm and ranch. We have a mill back there. So we do everything from planting seed all the way to processing the grains and ending up with bags of flour that we sell on the market. And so yeah, I'm really interested to just see what comes out of this and how we might be better able to serve those guys. We kind of say back there because they're on the back side of our mountain from the town site. But they're isolated out there. They work long hours. There's a lot of stress unique to working in agriculture because there's just so many variables that are outside of people's control. So they're at the whims of the weather and political climates and just you had the fluctuations in the market. All of that I can see being stressful. As far as a success, boy, almost every day that I could just get people to come in as a success. So a lot of them are very small little successes. I think of this job a whole lot like being a school teacher, and you have these tiny breakthroughs with individuals at different times, and so they kind of come and go out of my mind, but that makes me really happy when we do have those little breakthroughs with people. And in therapy, kind of helping somebody see something in just a little different way, give them a little shift towards positivity or so I do know we have some work to do breaking down stigma of mental health. It's not a macho thing, but I kind of keep telling them, hey, your brain is part of your body. So to me, I try to say this is just like the gym for your mind.
Right.
So I'm just glad that we're here. That we've got a really nice facility, and I have quite a bit of grant money that luckily isn't in jeopardy right now. So we've got a lot of potential to grow here. And hopefully this whole experience will give us some direction on how we could grow better in the future.
Right on. Well, thanks for joining us. And yeah, good to have you on the working group. And since you were a little bit late to join, I'll pass it on for you, and I'll pass it over to Calandra.
Everybody, Callie or Calandra, either way. Nice to be here. I'm the Behavioral Health Administration Regional Community Engagement Specialist for the Northeastern region of the state. And I am also the statewide agricultural liaison. I do live in Loveland, but don't hold it against me. I am from a 6th-generation farming, ranching family out in Northeastern Colorado. Did my time on the swather, making very small circles very slowly for hours all through high school. Happy to be here. My win, I'm going to share a little bit later, so I'll go ahead and pass it on. Let's see, Julissa, I believe you haven't gone?
Yes, Julissa Soto, Independent Health Equity Consultant. Also the Suicide Prevention Commissioner. And I think one of the wins is to see the agriculture workers at the conference in Delta June 8th receiving an award named after me, Agriculture Woman of the Year and Agriculture Men of the Year. So I think that's a great win. And I hope to see many of you guys at the conference June 8th. And if you're not available June 8th, don't worry. I always have events coming up. So I will sign you up, my friends. Thank you.
Thanks, Elisa. Katherine.
Hi, everyone. Katherine Harvey. I'm the Rural Strategies Specialist for the Office of Suicide Prevention. A big win that we have going on right now is at the very beginning of this month, we just got 12 new counties on as grantees in the Eastern Plains. We have a project you're going to hear a lot more from me about in a few minutes here called the Colorado National Collaborative Project, and it's for suicide prevention. We had not had any grantees that were out on the Eastern Plains. So we just added 12 new counties from the Eastern Plains to that project on April 1st, and I'm super stoked about it. And then private win, I was thinking about, because Mike brought it up, my partner, also a veteran, also a ranching family, also keeps bees, and his bees have also survived winter, which is super exciting. I'm going to pass it to Chet. I don't think you've gone yet.
Thank you, Catherine. I'm Chet Nelson. I'm a licensed clinical marriage and family therapist in private practice. My office is in Broomfield. Come from a farming ranching family. Spent some time in technology before I went back to Colorado State and became a marriage and family therapist. Successes, I agree with Richard. It's so rewarding to see those successes with patients every day. But my real success today was spending some playtime with my grandson this morning before work.
Love it. All right, and Julie, you were late to join the meeting. We're just introducing ourselves and sharing a success that we've experienced in the recent past.
Thank you. Yes, I was thinking the meeting was at 1:30, so I was a little behind times. But my name is Julie Elliott, behavioral health specialist for the Western Slope through Colorado State University. I've been doing this position for a couple of years now. I feel very fortunate in that I grew up in northwestern Colorado on a ranch, and so I have that kind of a background. Win for me was last week. I got to go and do what we call the COMET training for Craig and Steamboat Springs, and had exciting turnout for both of those presentations. So I feel like that was a big win most recently. Thank you.
Awesome. All right. Is that everybody? Did I miss anybody? Raise your hand if I forgot. Think we did it. Nice.
Did Robert introduce?
Ooh, good call, Callie.
I was trying
Who's
to
that
hide.
guy up in the far left corner?
I was trying to hide. I guess I need to turn off my camera if I'm going to hide, right? Hey, everybody, it's great to be here today. I'm Robert Sakata. I'm with the Colorado Department of Ag. I'm the Ag Water Policy Advisor, but when this group started up, I volunteered right away. It's one of my passions, really, to explore how we can expand ag behavioral health. So really glad to be here. And I'm going to share not a personal success, but one that we got through one of the question and answers from somebody that's just listening in. Is Sarah Cole said in the question and answer section that they're copying the Coffee Break Project up in Larimer County. So I think that's a big success and really wish her all the best of luck in doing that.
And just, even though she has her camera off, I will see if Rosie will willing to come off camera and introduce herself too. We're really grateful for her support of this group.
Yeah, hi everyone. My name's Rosie Scavrin. I am at CDA in our Drought and Climate Resilience Office, and I help doing admin for this group. And a recent success is I finally had time to really put some work into our website and our resource pages, so I'll be showing those off later in the meeting.
Perfect. Thanks, Rosie. And Rosie sent out the meetings for the previous meeting. No, sorry, the minutes for the previous meeting to all of you. Hopefully you've had a chance to review it. Any questions or revisions that need to be made before we approve those and put them in the minutes history? Anyone? Without any other notes, we're going to say those are good, Rosie. And I will let Calandra and Katherine choose who goes first and let them introduce themselves a little further as they share about their programs. But whichever one of you is sharing first, take it away.
I can go first if that works for you. Perfect. Let me figure out sharing my screen and making sure everyone's seeing the correct thing. Okay, there's that. Now I need to make you guys bigger again so I can see everyone's faces. Okay, is everyone just seeing the part they should see? Sweet. Cool. I'm starting my timer, so I'll be at exactly 10 minutes and then I'll cut myself off. So as I mentioned, I work for the Office of Suicide Prevention. The Office of Suicide Prevention is housed under the Colorado Department of Public Health and Environment, and we are the lead entity for suicide prevention, intervention, and postvention in Colorado. And then Calandra will be talking afterwards about what she's doing at the BHA, and the BHA is much more towards like that treatment end of the spectrum. So we're basically what happens before people end up needing behavioral health treatment in the first place. These are all of the wonderful humans that are in my office. Since I only have 10 minutes and there's like more than 10 people in my office, as you can imagine, I'm not going over the vast majority of programs we do. I just tried to pick out the stuff that was relevant to agriculture. A little bit about me. I'm the first rural strategy specialist that the OSP has. We realized a couple of years ago, this was both like lots of rural people were complaining about this, and then also, fortunately, the statewide folks were listening, that rural residents tend to die by suicide at much higher rates than urban residents do, both in Colorado and across the United States and internationally. So our office took in the feedback from rural communities that, hey, you guys aren't super great at working with rural communities always. You have a bunch of folks who are from urban areas that are overseeing a lot of these programs, and they just don't get it and how to more successfully adapt programs to rural areas. So that's why they brought me in as a rural specialist. I'm the first person in this role, and you can see some stuff about me on this slide. I'm based in Gilpin County, Colorado, so I'm a mountain girl. I've been a mountain girl my whole life. I have never been directly in agriculture, but as I mentioned, my partner who is in this slide is from a 5th generation ranching family in Gilpin County. So I've sort of seen it from that angle of seeing all of the family stuff that goes on there. And then I was also the 4-H extension agent in Gilpin before I took this job. I just wanted to ground us really quickly in the data when it comes to suicide specifically. So both for rural communities and for agriculture. So you guys can kind of see why we're doing what we're doing when it comes to those ag specific programs with our office. This is national data. Basically the darker red that your state is here is the higher your suicide rate. Colorado is consistently in the top 10 states in the country when it comes to our suicide death rate. Here is data from 2022 when we had been number 10, but you can also see that I put those numbers here in the corner showing that our rural rate is quite a bit higher than our urban rate is. And again, I just have this map here where this is the statewide level, so you can see by county. Typically, the counties that have the highest suicide rates, those are the darkest ones. Those are all rural counties for the most part. And our urban counties tend to have fewer rates, but higher counts because there's way more people in urban counties, right? And then this is data that I pulled together this morning to go over it in particular with y'all. If you are interested in digging in more to our data, we're really lucky to have really comprehensive suicide death data for Colorado. So you're able to kind of slice and dice it in several ways. So I wanted to look at 4 folks who were identified by their coroners as being involved in agriculture, forestry, fishing, or hunting. This is deaths from the past 10 years of data that we have. You can see it was 189 deaths throughout that time period. 92% of those deaths were male. 66% of them were by firearm. And that's compared to the overall state average is that 51% of total deaths are by firearm. So you can see for ag in particular that that's much higher, and it's about 2 out of 3 deaths, which probably is not a surprise to anybody on this call. You can see when it comes to the age of those in ag who died by suicide, it's really all over the board. We don't tend to see it for that youngest age range. The youngest ages that we had was 16 to 24, and it was a pretty small percent of those total deaths. And we really see that 25 all the way through 65 plus, and that those are pretty evenly split amongst those three different age groups there. And then the final data piece that I threw in here was that we also have circumstantial data. So this was what coroners reported after they did interviews with families and loved ones of the person who died by suicide. Did the person have any of these circumstances associated? Again, this is ag suicide specifically. And you can see that one takeaway, there was not one overarching circumstance for the majority of ag deaths, period. Less than half had a history of suicidal thoughts or plans, and nearly as many of those folks had a contributing physical health problem. Less than a third had ever been treated for a mental health problem. So something we often point out as an office is that when we're thinking about suicide prevention, often we skip immediately to treatment. What treatment is available? How can we make it more accessible? That's a really important piece of the puzzle. But also we want to be focusing on all of those other supports within the community that are creating an environment in which that person may be more or less likely to want to die by suicide, because we know that most people dying by suicide actually do not have a mental health diagnosis. They may not have ever seen a provider. So what are the other community level supports that we can put in there? And then for actual programs that our office does, this is a map that you can find in our most recent report that's available online, and I'm happy to link it if people want access to it, but it's sort of showing you of some of our programs that are easy to track by which counties are doing it. You can look at what your county is specifically and what programs that we currently fund in those areas. And we do have programs that hit all 64 counties in Colorado. The main one that I'm just going to go over real quick today that is most relevant to us all on this work group is the Colorado National Collaborative, which I mentioned during my introduction. The Colorado National Collaborative is a comprehensive suicide prevention project that takes place at the local level. What we do is we fund backbone organizations. So that might be a community mental health center. It might be a nonprofit. It might be a local government agency. And that backbone organization then brings together a coalition of a bunch of local partners. So that would be all of you guys on this call. If you are in a county that has a CNC coalition, you would be somebody that would be considered like a local level partner, right? So that can be people with lived experience of suicide, schools, local government, nonprofits, businesses, etc. And everybody gets together to work to prevent suicide. So you can see that these dark green counties, these are sort of like our ongoing grantees that we have. We have quite a few in the Southwest region, not any right now in that Northwest region. So I work a lot with the other folks like reps that are up in that area trying to provide more informal ad hoc support. We have some that are along the Front Range here. And then, as I mentioned, we just added 12 new counties in the Eastern Plains just for the next 6 months with some extra funding that we had to be able to implement these strategies. So super excited about that. It's a really big deal. And then I'll just briefly go over what some of the work is that these organizations are doing at the local level and their ag specific work. So first of all, they focus their work through these 6 pillars that you can see here at the side. The first pillar is connectedness. So we know that isolation, stigma, discrimination, all of those things lead to increased suicide rates, and the antidote to those things is community connectedness and belonging and combating social isolation. So organizations at the local level identify creative and locally appropriate ways to enhance social connectedness, however that makes sense for their community. In terms of ag, this has included things like paying for meals and food for locally organized groups, similar to how JC's Coffee Break Project does it. Recently, Montezuma County started a coffee, crops, and cattle event in their local coffee shops where they're paying for coffee for farmers and ranchers to be able to get together. They've been getting really good attendance. And then often these counties also are funding suicide attempt or loss survivor support groups. So that's all under the umbrella of connectedness. Next pillar is economic stability and supports. We know that job and income loss or instability can be linked to suicide. So coalitions tend to work with organizations that are supporting economic stability on the ground. That might be things like food banks, local transportation organizations, if there are any in rural areas, homeless shelters, and so forth. I couldn't think of ag-specific examples that any of our coalitions have done, but that's one of the buckets that their work falls into. We have education and awareness. That includes hosting community helper trainings, which is teaching people how to identify the signs that somebody might be in crisis. What can they do about it? How do they talk to that person and get them to resources? So our organizations or our grantees have done a ton of work for education. Some of them have done COMET, which I think we have already, somebody presented about it in an earlier meeting. So COMET is a community helper training for rural and ag communities specifically. There's other ones. I know that Montezuma partnered with CSU Extension at one point to do fewer, and I think that was with Calandra, so Calandra might be able to speak more to that later if anyone's curious. So that was another targeted ag rural training, and it had a specific focus on lethal means safety. One other example we had of this for ag is that Pueblo County, they purchased long sleeve shirts for farm workers that had mental health messaging on the side. So they had the 988 number, they had messages in English and in Spanish. So passing out PPE to farm workers with that mental health info. And then I'll jump over to lethal means safety because I already talked about it a little bit. I mentioned how most ag worker suicides are by firearm. So local coalitions will do messaging around lethal means, sharing that education around what does firearm safety look like when it comes to suicide prevention. And they also support the Gunshot Project, which I have a slide on. And then access to safer suicide care, that's more hospital and clinician focused, but includes training clinicians on doing suicide specific therapy. So that could include things like getting clinicians trained in programs like Land Logic so that they're more responsive to being able to work with ag producers. And then finally, the sixth pillar is post-intervention. So that's the support that is provided after a suicide attempt or loss in a community. I don't have anything that was like ag specific for that, but one of the things our grantees do is at the county level, they'll make an actual post-intervention plan for once a suicide death occurs in the county, first responders are on scene first. How do they pass it off to the coroner? The coroner, who do they notify, who can be part of like a suicide squad basically to come out and talk to the people who have survived the suicide loss? What sort of follow-up is happening afterwards, that is actually a coordinated approach at the local level. I mentioned Gunshot Project, so this is that lethal means safety messaging. So we fund the Gunshot Project for Colorado. This is where we provide different organizations throughout Colorado with funds to go and do site visits with gun shops, firing ranges, any events like county fairs and rodeos, anywhere that firearm owners are likely to congregate, right? And so they share materials that are about suicide prevention, firearm safety, explaining those links and what can you do to keep yourself and your family safe. If somebody might be experiencing a mental health crisis in your household. And we do, like, the intention of this project is that we're funding local organizations who then are employing or contracting with a local firearms owner who is a part of that community, is able to authentically be able to talk about these things and isn't just somebody from the state coming in and being like, hey, I wanted to talk to you guys about your guns, right? So making sure that it's authentic and local interested messengers. And then the only other thing that I just wanted to bring up is we also fund the Man Therapy campaign in Colorado, which you might be familiar with. This is a public health campaign that is really targeted at that men in the middle years age range. And it's really for dudes who would not ever want to go to therapy, right? This is like my dad and my brother and my partner. And so it's trying to use like a humorous approach to get guys to be like, hey, if you ever were to happen to want to know what sort of resources were out there, what sort of therapists are used to working with men, here is like a website and resources around those things. So there's all sorts of videos I'd be happy to share in the chat. But that is a campaign that we also support to try to figure out how do we help reduce stigma amongst this population that we know is dying by suicide at the highest rate. And we are working on doing some more ag-specific materials for this as well. So if that's something you have ideas on, feel free to let me know, because I am the person that is directly working with that marketing team around what can we sort of develop that's targeted at ag producers in particular. And I think that's it. Oh, you can stop it. Okay, there we go. So that's everything. And then I will stop sharing my screen and I'll pass it over to Callie.
Thanks, Catherine. Before Callie gets started, just wanted to note that when Callie is done, we'll open up for questions for both of you. So we'll keep this flowing, but if you have questions for Catherine, write them down, and then we'll let people engage with you from this group and from the general public. All right, thanks, Callie, or thanks, Catherine, and Callie, you're up.
Awesome, thank you. Let me turn my slideshow on. And okay, tell me, are you looking at the right? Yay. Always glad when that works out. Calandra, Lindstadt, thank you guys for giving me just a minute to share a little bit about the BHA. And I also started a timer, so I will work hard to stay on track and keep up what Catherine started so well. So behavioral health, Behavioral Health Administration. And I'm just going to share a little bit about our roadmap, kind of where we're planning to go, and then a little bit about our rural engagement. That is not, there we go. Yeah, high level overview, moving on. So the BHA is your state level organization that's responsible for ensuring that everyone in the state of Colorado has access to behavioral health care, regardless of barriers like ability to pay, documentation status. We really want to make sure that literally everyone in the state has access to these services and that they're high quality. Obviously, that's a process where we're working on it, but I'll share a little bit about how we're headed in the right direction. So these are our top 5 priorities, and we launched this new roadmap in July 1st of 2024. We are working on updating our behavioral health safety net system. You may have heard about the BASO launch, the Behavioral Health Administration's service organizations. Basically, we're redesigning the behavioral health care system. It's going to be a lot more streamlined, but all of this takes quite a bit of work, and it's a process, it's a journey, but hopefully once we get out the other side, launching July 1st, 2025, things will be a little bit more streamlined, a little bit smoother. We're also really focused on the behavioral health care coordination system, doing a better job of coordinating care and support across the state. We have launched our Behavioral Health Administration Performance Hub, which is a data dashboard that is providing much more like specific metrics for folks. And I want to offer everyone the opportunity to make suggestions on metrics. We're always open to providing the data that our community really wants and needs. We have launched a new healthcare grievance and complaint process, and I can give information on that. And then the Children and Youth Behavioral Health Implementation Plan, totally renovating that whole system of care and making it really responsive to the state of Colorado and our families' needs. So a little more info on the Performance Hub. This is, it's a really cool interactive database, and we are taking a lot of input from the community. So if you go and you explore and you're not seeing the data that you're looking for, let us know. One of the things that came out of recent engagement with the community was an interest in county level data. So we have added county level data to this dashboard to make it more useful for our public health folks. The grievance and complaint process, I already talked about this a little bit, but I will make sure that the website for this is embedded in these slides and that I share them out. This process is in English and Spanish. So if you ever have a complaint with a care provider in your community, you can submit it through this website, trying to make that a much easier, simpler, more straightforward process. And then I just want to highlight all of our statewide services. We have some really cool stuff. You're probably familiar with many of them, but they're so crucial that I just like to point them out in every presentation. 988, it's a mental health crisis hotline, 24/7, 365, English or Spanish. I've called it. The wait times are pretty brief. You will get routed to someone in Colorado. However, if wait times are a little bit longer, I think it's over a minute, maybe a minute and 20 seconds. Don't quote me on that. But if wait times are a little longer, they might route you to someone outside of the state just to make sure folks in crisis meet another human being as quickly as possible. But I've called several times now to test, and I get routed to a Colorado office pretty quickly. OwnPath is a searchable database of licensed providers. It has a map, and you can see everyone in your region, in your area. You can narrow it down by like some specifics. So if you're looking for a provider who serves youth, for example, you could narrow it down that way. The I Matter program is a program that offers 6 free sessions of counseling for youth, and it's in English and Spanish. You can select live or remote when you go through the application process. I have a feeling many of our rural communities are remote, probably, but they do have some live options depending on where you're at. And youth can sign up for iMatter without a parent, but not if they're under a certain age. So Lift the Label is a stigma reduction campaign. One of the cool things under Lift the Label are the recovery cards, which are really cool opportunities to start conversations about substance use disorder and addiction. They are like greeting cards that have encouraging messages in them. If anyone is interested in getting a Lift the Label greeting card display, send me an email. I'll be happy to help you order that for your office or like front area for folks. Tough as a Mother, and then community reinforcement family training. And if you're interested in any of these, please reach out. I'm going to move forward because I want to share a few more things. So I wanted to also talk about our community engagement model, which is really the BHA's commitment to bringing rural along, right? Like having folks in the community of the community connecting with the community so that it's not just Denver creating programs and sending them out into rural Colorado and saying, this will probably work. So that's me. I am one of the new community engagement specialists. This is a team of 4 regional specialists. Each of us lives in our region. So I'm in Loveland. I serve the Northeast. Well, and I'm also the statewide ag liaison, and we have a tribal liaison. I'm stopping myself because I have a map on this page. I serve the Northeast. So I have that Jackson, Larimer, Boulder all the way out to the state line. And I love, Katherine, how you had your photos of yourself. I was just going to talk about myself for a second here. I am from that little corner, Phillips County and Logan County. If anybody's been to Haxton, you have probably met someone I'm related to. And I'm really proud to be able to be back here serving this community that I know, love, and care about. As I do this work, I really picture my grandfather and my uncles, everybody standing around in the morning, and they just give one word conversation. It's a very quiet, peaceful moment. And somehow at the end, everyone knows what they're supposed to go do. But I can't imagine any of those men stepping foot into a provider's office. So I love that this group is thinking of creative opportunities. How do we support these guys who are so independent, so strong, but also probably still need our help? How do we support them in creative ways that we can actually connect with them? And then you can see there are 3 other regions here: the Western Slope, that sort of central urban mountain area, mountain resort communities, and then the Southeast. And see. Okay, so just what do? We're the local BHA liaisons. We promote BHA programs and services. We amplify diverse voices, and we facilitate regional collaboration. So each of these 4 pieces kind of makes up our role. But the main thing that we do is just make sure that the voice of our rural communities is being heard and has a place, and that y'all are aware of things that the BHA is planning to do before we do it, so you can have input and engage with these processes. Okay, this is some of the stuff that we've done. I think this map is cool because it shows some of the places we've been. Obviously, we got more places to go. And that is what we're up to in the coming months. Over the summer, we have commissioner community conversations. They're all over the state. I know we're going back to some of the locations, and then we're also going to new places like Lyman. We weren't in Lyman last year. We have a launch for the Bassos at the Capitol, July 9th. I will get specific times for that and send it to this group. We have engagement with the Friends and Family Input Forum, and then the BHA Advisory Council. This is a really great opportunity to engage with BHA. It's an statewide advisory council. You get to join, participate, hear about the initiatives that we're working on, give your advice, give your feedback. It's pretty cool. If anybody is interested in any of these upcoming opportunities, please let me know. I'll have more specifics. I'm 30 seconds over, Clinton, but I'm going to stop now. Thank you. There's
Thank
too
you.
much.
No, that was a lot. And once you, yep. Okay, want to open it up for questions. Katherine and Calandra, thank you so much for sharing. You guys are obviously up to a lot, and there's a lot going on at the Office of Suicide Prevention and the Behavioral Health Administration. So want to open it up to questions from the working group. If anything that was shared, you want a little bit more, or to the people who are watching, Rosie and Robert, if you guys will watch the Q&A, we'll open it up for the next 5 to 8 minutes if needed.
Clinton, can I ask a question?
Go for it.
And I know that you guys are going to be like, here she goes with the Latino community. But, you know, I honestly need to advocate for my community, those who don't have a voice, those agriculture workers who are monolingual Spanish speakers. And I would love to see representation of, you know, directing whoever is directing the Bassos, or being myself on the statewide committee or leading one of those Bassos, because I am and I reflect what those agriculture workers will love to see. So I'm just putting myself out there, because I just, you know, I see a lot of committees, a lot of times we do a lot of work, but the people that it's involved doesn't look like those agriculture workers. And I don't want them to have a doubt for a minute that we don't understand where they come from, because I'm part of this committee. So I can easily be that bridge between the agriculture workers and my committee, and be the voice of the voiceless.
Yes, thanks for voicing that. Katherine or Calandra, you want to add anything from either of your organizations that might speak to that?
Just since you mentioned the Bassos, Julissa, I will also make a plug that we will be having recruitment for regional Basso advisory councils coming up. So I believe that will probably kick off in August, but please keep an eye out. We are very committed to making sure that those are diverse and representative councils. And it's going to be an awesome opportunity to engage with the healthcare system and make sure that you're advocating and shaping it in the way that it should look in order to serve everyone, which is our mission. So keep an eye out. The BHAC, the advisory council that's statewide, that closes April 28th. But if you're feeling a little overwhelmed, those Basso advisory councils, those are coming up. So.
Yeah, and I'll just add briefly, Julissa, as a suicide prevention commissioner, you know a lot about our different programs, but just for everybody else on the call, something that I wanted to put out there too is for those recent grantees for the CNC, the 12 new ones that are on the Eastern Plains. One of the requirements that we had for them in the RFA process when they applied for that grant was to tell us how they were planning on making sure that they were going to be a representative of and reaching Black, Indigenous, and other people of color, and specifically Spanish language speaking populations within their jurisdiction because, right, in the Eastern Plains, there's a very high proportion of Spanish speakers out there. So that is something that we are really actively thinking about at OSP of, okay, we are passing through a lot of money to the local level, and how do we make sure that those local level coalitions are made up of and represent the folks who do live there? Thanks for the question, Julissa.
Agreed. Thanks for that question, Julissa. We always will hope and expect that you will bring that voice and that reminder that we need to be sure that we are representing all people in this. So don't hesitate to ask those questions. Who else? Anybody else have a question for Katherine or Calandra or a statement?
I have a question. So I noticed that a lot of counties aren't on the Colorado National Collaborative yet. Is there a criteria, or how would we advocate for our county to get involved in that and on the list?
Yeah, so the original, so CNC counties that were originally on there was it started with 6 counties, and that was about 5 years ago, and it came from funding from the CDC, and then we were able to add a few more 2 or 3 years ago. That was a lot of like what you see in the southwest part of the state. And then there was like yet another bucket of funding that allowed us to do the Eastern Plains. Basically, the complex answer to your question, Mike, is that we don't know if we're going to continue to have funding because of the federal cuts for the CNC project. Currently, our original 6 grantees, their grant is going to be up at the end of August. So we're waiting to see if we're going to have money released from the CDC that we would apply for, and then from there, if we got it, we would distribute it out. So that is the next possible time that we would have that open for funding to be able to go out to communities. And and this is like another good thing for the group. If anybody's like, I would want to know if and when that happens, please like email me directly and let me know. Because I would hopefully remember to let this whole group know, but I also am concentrating really specifically on those rural suicide prevention organizations or coalitions that already exist, like reps, so that I can like email them as soon as I see any possible funding come up for CNC. But basically, the issue is we're waiting to see if that is federal funding that will come through, and that's how that's funded.
Awesome. Thanks, Katherine. Anyone else? We got a few more minutes available for questions if we need them.
I just want to say I appreciate both of y'all's presentations. And Katherine, I'm always looking for good data on specifically ag suicide rates, contributing factors, and things like that. There was a recent article that just came out in the Journal of Rural Behavioral Health. So I dropped that in the chat, but I was curious if you would be able to share that slide that you had with that overview of your data specific. That'd be fantastic if I could use some of that. So whether you want to, if you could drop it somewhere to share it with all of us, or just shoot me an email later, I would love to be able to cite you all as a reference for that. The local data is fantastic. So
totally. I think I should be able to mess around in here and get something posted in the chat for everyone before the meeting is over that just has like the copy of that slide. And then if anybody ever just like wants a quick tutorial on how to go through like this suicide data dashboard that's online, I can show you real quick. So happy to set up like a 10-minute meeting offline, Chad, and I can just walk you through how I grab that data too.
Love it. I would absolutely take you up on that.
And if you guys are willing to share, I'm sure that Rosie could send that out to the whole group if you just wanted to send your slide deck to Rosie. That way everybody could have them, but let us know what slides you would want us to attribute to your respective organizations. Thanks. Or I should rather say that if anybody uses those slides, be sure that you're relating them back to the source that they came from.
Lay has her hand up.
Okay.
I just real quickly wanted to add to the conversation about data, and I know you all know this, but as someone with lived experience coming to this conversation, the data is reflective of individuals and humans that we have lost, and the data helps us untangle that mess and understand how to be better supports and how to serve that community better. But I think the data conversation is really important, but I also always want to be really mindful of the individuals.
Yeah, thanks, Calandra. And sticking with kind of that comment, I'm curious, Catherine, as you guys are doing these social connection events as one of your pillars was talking about and providing gatherings for folks around town, I've been really curious about data that's available for people connecting and then feedback that they say how that social connection has impacted their either tendency towards suicide or other behavioral health issues that they may be struggling with, because I think that that's really important. I love that it's one of your pillars, and I'd love to know how those are impacting these rural communities, because anyway, as we can look at the goal spreadsheet, that was one of my goals, is for us to figure out ways to get more gatherings for people.
Yeah, that's like a whole can of worms that you just opened up, so I'll try to keep it brief. When it comes to the CNC project in our evaluation model, we don't have anything that is specifically for social connectedness events. How do we measure any specific outcomes from that? It's like a whole thing with our evaluation model, right? Because we're trying to take now 27 really different counties, and they're all implementing fairly different things and trying to figure out, okay, what are some possible shared measurements across the board? So there's nothing we do as an office that specifically is measuring what you're talking about. I can think of some instances where I've had conversations with grantees where they're like, well, we would like to at least be able to do some sort of evaluation when it comes to these one-off events, but that can also be really hard when you're like, okay,
Yeah.
have a bunch of farmers show up for coffee, but are they gonna fill out my 15 minutes survey? No,
You're naming it.
Never come back. So we've brainstormed about possible ways to do something similar. This isn't ag-related, but one of my grantees down in La Plata County, we were recently brainstorming about a mental health movie day for kids that was hosted by a local library. And something I had suggested is doing a very kinesthetic evaluation where you have a bunch of marbles, and then you can put marbles in as you're leaving of did this inspire your family to talk about emotions or whatever, right? I'm clearly not an evaluator. I'll come up with good evaluation questions. So I think that there's innovative ways to try to think about how can we measure those pieces of data to show that this is meaningful. I also am not the right person to sit there and try to figure out what that would look like, and that's not something we currently do at the statewide level. But I would love to see it if anybody has thoughts.
And maybe that can be some conversations with our work plan. So if you have further questions for Catherine or Calandra, don't hesitate to reach out to them beyond this meeting. We are going to move forward. Robert, were there any questions that came from the public that we need to address before we move on? Okay. So the work plan group that volunteered at the beginning has met a couple of times, and thanks to Catherine and her work helping create a spreadsheet, and Robert and his work organizing our goals that we gave as a group and the goals from the Senate bill that organized this working group. We created a goal spreadsheet that is available on the agenda that Rosie sent out. If you have the agenda, you can click on that, and you should be able to pull up that goal spreadsheet. We're not going to spend a whole lot of time going through this today, but what we did want to do was make everybody aware of it. Our goals have been put in and grouped with the goals that the Senate made for this group, and we, as a group, as a work plan group, talked about creating some committees. One of our hopes the work plan was engaging was that we could figure out a way to get all of us more engaged in the work that we're doing, and also working together on some tangible goals that people mentioned when everybody shared their goals. So thank you to whoever just shared that spreadsheet. On the spreadsheet, you'll see the goals are highlighted, that we've broken down the main goals that come from the Senate bill. On the far right, there's a space where it says person subcommittee responsible. If any of those goals really stand out to you, I would say add your name there. I think everybody has, do they have editable access to this, Rosie or whoever sent this out?
Yeah, people should be able to access it. If you don't have a Google account, you might have to jump through an extra hoop of permissions, like they'll send you an email to confirm, but shoot me an email if you have any trouble accessing it.
Well, I say this because I'm often challenged with Google Sheets, but as long as you don't delete who's already there, please feel free to add your name on one of those goals that you feel connected to, and we will try to organize and break you up into committees and let you know who else is on there so that we can do that. We haven't really talked about the next steps on how those committees will be formed, but the best way that I can think of is if you can just add your name next to a goal that speaks to you or under one of those highlighted main goals from the Senate bill on the right side where it says person subcommittee responsible. I feel like I just used a lot of words and I'm not sure if it's clear. Does anybody have any questions about what I just requested of you? The hope is for everybody to get involved. I can't see everybody's picture. I can move this. If anybody's raising your hand, just speak up.
And I just wanted to add, I don't think everybody has editing access, or maybe they do now. It looks like everybody does. Okay.
Yeah, it was just the work group initially, and just now everyone in, it was the work plan group, and now it should be everyone in the work group.
Thank you, Rosie.
Anybody have any thoughts or questions about those goals or this idea of us working in committees? Once the committees are formed, you all as committee groups can figure out how you want to interact. The one caveat, and Robert or Rosie, correct me here, when your committee does meet, if you meet as a group, we do need to post that as a public gathering so that if anybody from the public wants to listen in, that's available. We will follow up with more details on that at the next meeting to say how that can happen. But my hope is just that we can make sure that people get plugged into a committee group so that we can start interacting with each other and tackling some of these goals that we set out. Robert or Rosie, Katherine or Calandra, JC, anybody else who is on that call, what am I missing here around how we want to engage these goals in this work plan?
Yeah, I think I would just say, just to clarify, so what we were envisioning, and it's cool if people have other ideas, but this was sort of like our initial proposition to y'all, is that one of the subcommittees is going to be that compiling best practices one. One subcommittee is going to be identifying gaps and collecting data on outcomes. And then that the other subcommittee would be engaging with other stakeholders and be everything that's below that. And once we get into those three groups, then we will figure out more of like, okay, what's a work plan for actually working on those activities that fall under that. So that is the ask of everyone in this group, is that you will identify on the spreadsheet if you would like to be under best practices work group, gaps in data work group, or engaging with other stakeholders work group, or sorry, subcommittee. We agreed we're not calling it work groups because this is a work group.
Thanks for saying that. I forgot that we had talked about joining the gaps in data. Any other questions or any thoughts that people have around how we can better execute our work around this, or questions about how we move forward with these committees?
I think this looks like a great structure to start with. It sounds like a good foundation, and then just looking at where we can plug in and support some of those efforts as those subgroups sound really good. So appreciate all the footwork you all did on that. Looks great.
Yeah, so that's my ask is as soon as possible, put your name in one of those underneath one of those groups. We will organize those and get the groups connected. And then at the next meeting, we can talk more about what that looks like, or we'll send out specific instructions around how to make those gatherings that you have public. Okay, Robert, Rosie, anything else that I'm missing around that?
It's good, Clayton.
Okay. And Callie, Chad, update us on the provider training and COMET community training. What do we need to know about that?
Well, I'll do just a quick. So one of the things that came out of this bill is that BHA needs to provide cultural competency, humility training around agricultural culture. And I need to come up with a better way of saying all of that and not using the word culture so many times. But it's going to be really important that when we get these folks, our ag community through the door and they're finally approaching a behavioral health professional, that person understands the unique stressors, the background, the things that this person either is going through or may have gone through that is bringing them here to this moment. And so we have some funds to train our professionals in order to have them be better able to meet the needs of their clientele. That being said, this first year we have funds, cultural validation. Thank you, Lisa. I appreciate it. And so we have funds this first year that go away June 30th. And so, but we also have the blessing of additional funding through 2029. So this year we had to spend the funds that are earmarked for fiscal year 25, 24, 25 really quickly. And if you've ever tried to spend money through an organization like the state or maybe an academic institution, you know that there's a lot of layers, a lot of paperwork. It's kind of intense. So we had to move pretty quickly to get these purchase orders put through. That being said, we've identified a really cool program that I'll let Chad tell you about in just a second. But we've identified a really cool program to invest in this year. Relationships were already in place. We're already really familiar with the program. We know it's a very high quality product, super excited about it. So we're purchasing that one this year. And then going forward, we will be developing much more intentionally, or not more intentionally, just for some of our underserved communities, for some of our communities that I wouldn't be a good person to select the programming for because it's not my area of expertise and I don't have as strong of relationships. We're going to take a little more time and develop a program with and for the communities. And so we're also tasked with supporting our tribal communities, our ag worker, migrant, seasonal communities, specifically our Spanish speaking communities. So for those communities, we want to take a little more time, be a little more intentional. So we're going to look at the money that's earmarked for future years and really develop something very intentionally with and for those communities. So we have something coming down the pike, right away for more of the general ag community across the state. And then I've been having meetings and am connecting with folks. We'll start developing something a little more specific, a little more tailored for some of our other underserved, underrepresented ag populations. I think I'll stop there for a second and see if there are questions. This is kind of a high level and it's coming at you fast, but hit me if you have thoughts or ideas. And this was my win. This was my win that I didn't talk about at the beginning. I was going to say the camp program, but I'm glad Tim highlighted that. But for me, getting this money spent was like such a relief. So I'm going to pass it to Chad and let him share just a little bit about the program that we are selecting this year, Land Logic.
All right, thanks, Kelly. So I will go ahead and share my screen and I'll try to get through this as quickly as possible so we have a little bit of time for discussion yet. All right, and is that showing up the way it's supposed to? Fantastic. Okay. So Land Logic is kind of the culmination of about 3.5 years worth of work that we've been putting into developing this. And it really stemmed from when I joined the AgriBility program 4 years ago, and we tried to look at holistic approaches to our primary objective, which was trying to reduce suicide and farm stress in ag communities. There were training models that helped people understand those specific cultural strengths and stressors that people in agriculture may experience, but I could not find a specific training model that really helped clinicians in developing interventions in the actual therapeutic and clinical work with ag populations. So that's kind of where we started with this. So the idea is that we wanted to make it relevant for ag voucher programs. And there's about 18 of these across the country right now. 18 states have some version of this. So we wanted it to be short-term, 5 to 10 sessions, solution-focused. The clinical framework that this is based on comes from cognitive behavioral therapy and action commitment therapy. Most of it was drawn from my experience as a provider for 20 years, working with multiple different cultures, problems, age groups, things of that nature. And I learned very early in that we had to make it relevant to the groups we were working with. And then it's also not meant to be a high fidelity model. It's non-prescriptive. We're really trying to promote client-centered care, optimizing deep cultural values within agriculture. And we want to encourage providers to really look at taking things that are tested and proven in their clinical work and make it relevant for the populations they work with. So it's largely based on the idea of ecological validity, which is the assumption that behavior can be fully understood only when viewed in its naturally occurring context. The most relevant agricultural concept of this that I'm aware of comes from Dr. Rosman. He's kind of considered the godfather of agricultural psychology. He's a farmer and psychologist in Iowa, was very prominent during the 80s farm crisis. But he says the agrarian imperative is an innate connection to the land, really a genetic drive that propels people to preserve that land at all costs. So we felt like that was a fantastic concept to kind of guide us. And from that, the embodiment of this really came to the co-developer and founder of Land Logic, Kayla Anderson, pictured here. She saw this as embodied in the idea of the aerial photo. And if you're not familiar with that, almost any sort of farm homestead will have some overall picture of their land or some capture of that, or maybe it's their champion bull or whatever it may be. And so we saw that as a fantastic window to allow clinicians to get a worldview and to step inside the producer's environment. And so as part of the initial sort of engagement in encouraging clinicians to engage well with people in agriculture, we really want to lean into that idea of the aerial photo. And this could be something like pulling up Google Earth and getting a picture of someone's operation and having the clinician really sort of ask the producer to walk them through a typical day. What are the areas that you find most stressful? What are the areas that give you a sense of meaning and purpose? And in the development of this model, we did focus groups with over 100 producers here in Colorado. And we tested this out by just having them do drawings of their land and asked about what parts of the land you could zoom in on one aspect of farming that brings you joy. What would that be? And a couple examples are harvest, smell of rain, excitement, renewal of spring lands, watching the goat kids play, moving livestock to fresh pasture with kids at my side. But it resonated well with people. And it seems like a great way for clinicians to get into understanding the day-to-day of agriculture without myself having to be an expert in soybean production or whatever aspect that may be. So again, since it's short-term and solution-focused, we wanted it to be utilized in relatively small number of sessions. So we developed this case conceptualization tool that sort of guides clinicians through this process. And we have developed interventions and have worksheets for each of the steps along the way. So we look at 4 key parts, which is formulating the target or problem, which is really about developing good alignment with your client around what is the actual clinical focus for your time together, assessment of resiliency and protective factors, one of the things I found working in at-risk youth was that those kiddos could report any problem label they've ever been given or discussed around them. But if you ask them what makes you a good son or a good daughter, a good friend, they had a hard time with that. So we want to start off very early in the process by identifying what's working well. So we have an ag-specific assessment of resiliency and protective factors. Remember, what's important is about identifying values and creating, making sure that any work we're doing aligns very clearly with the values, that our producers understand the values that drive their work, that they communicate that in their important relationships. And the last one is about making a plan where you work collaboratively to develop interventions that hopefully specifically relate back to someone's relationship with their land, with their operation, with their day-to-day work. We also have a barbed wire thinking cognitive distortion workbook that is very specifically geared in agricultural examples. We have some great art that we were able to contract to help illustrate some of these concepts. And then we have provided the full 3-hour training of this to 202 providers across the country, really. And we've collected evaluation data from that, which in its initial form is very promising. So 98% said it would help build trust. This is 98% of the 202 people that have gone through the training and completed our evaluation. 98% it would help build trust with clients. 96 said it would increase client retention. 98% said it would help promote positive outcomes. And 100% of participants who have mostly agricultural clients strongly agreed they would be able to apply the training to their practice. So I've got the link to the website there. And then Dr. Rosman was kind enough to offer an endorsement for us. And our win was that just 2 weeks ago, The Guardian focused on this particular approach as an article in some of their work. Now, granted, this really leans into Kayla being from Kansas. When we developed this, Kayla was living here in Colorado. So there's a lot of Kansas focus in the article, but it does do a nice job of kind of explaining the sort of theoretical underpinnings and the hope that we have through this particular work.
Awesome. And Katherine just dropped that article in the chat while you were talking, Chad. So everybody can access it there. Calandra and Chad, thanks so much for that overview. For the sake of time, I'm going to move us forward, and I'm going to say that we will give people a COMET update via email. We can send out information. I think everybody knows what COMET is, and we can let them know the plans with that as they develop. Moving forward, since we have like 7 minutes left, I'm going to pass it over to Robert and Rosie for updates from the CDA. And then we'll try to have a couple minutes at the very end for any other updates.
I'll start off real quick. The request for proposals for the Ag Behavioral Health Summit, which is part of the requirement of the bill. I extended that deadline to the middle of next month, so I think it's May 15th. If anybody needs a copy, the link is on the agenda. Want to get that out, and so I can get proposals in. So thank you very much, and I'll pass it on to Rosie.
Thanks, Robert.
Cool. I'll be brief because we're running short on time. I'm going to drop the link to our website in the chat so people can poke around on their own time. But I will just say that I am very open and excited to have feedback. But basically what I have done is created more of a hub for our website. Instead of having 2 disparate pages, we now have pages that are linked by a menu on the left. And I'll just share quickly my screen. All right. Can you all see this?
Yep.
Okay, great. So we've got our work group first and foremost. So this is where people can see our agenda for the upcoming meeting. They can watch a recording of our last meeting and read the minutes. And then they can read about you all. Sorry, this formatting is not as clean as I would like, but it adheres to accessibility standards that the state must follow. So you can click expand all if you want to see all the sections at one time, which is helpful. Moving right along, we've got our resources tab. So I've shifted things around to prioritize the resources that we want people to see first and foremost. If they are coming for help, we want them to be able to get that right away. And then we've got this table a little lower down, which has a lot more information. Again, this is to adhere to accessibility requirements, but you can always click this link here, which takes you to the Google Doc, and is very easy to use, very searchable. And this is where I'm pulling any resources that you all have put on our brainstorming doc and making sure that they end up in this table. So if you're not seeing something that you would love to be in this table, please add it to the brainstorming doc or email it to me. And then over here, I'll skip over this tab for now, but this is where we'll have information, hopefully, about upcoming grants and funding opportunities. So this tab just has information about the grants we had in 2022. And then lastly, we've got this upcoming events and opportunities tab. So this link is to the Google form that I have shared out previously. So anyone from the public can submit an event that they would like to see on this page. Right now, I just have 2 events and 2 funding opportunities. And I'm going to plan to update this on like a weekly basis so we can keep it up to date. I hate a web page that has old information. So we'll keep it like super current up to like a week. And yeah, I would love to fill this out with more events. I know there's a lot going on in all of your communities. So please email me or fill out the Google form. And that's that.
Awesome. Thanks, Rosie. And then did you have something you wanted to say specifically about the planning for the July 22nd?
So tentatively, we are figuring on a in-person July 22nd in Pueblo. Jacob's gonna confirm that we have a room available, but he's pretty sure we do. And most likely it'll be a longer meeting. We'll start maybe 10:30 and end at 2 or 2:30. Allow people time in the morning to get there and then enough time at the end to leave and then time for more presentations. We had initial conversations. Sorry, JC, we're gonna run out of time, but JC has an idea where we're gonna work with him potentially on a longer presentation of potentially partners that we can all work with to really promote the work that we're doing. So hopefully we'll include that. And then also I'm working with Calandra for the June 24th meeting, potentially to do a COMET training for any work group members that would be interested in the morning. And then we'll have our regular Ag Behavioral Health work group meeting in the afternoon at the Department of Ag. It'll be hybrid. The work group meeting will be hybrid, but anybody that wants to attend in person, tentatively, we're setting that up for Tuesday, June 24th. Thanks, Clinton.
Awesome. And we've got like 2 minutes left. Does anybody have anything going on in the next month before we meet again that you want to be sure that the group knows about? If you do, you've got like a 10-second slot to make a commercial pitch for it. 15 if you need it. Any events?
I have a COMET training coming up in Paonia. It will be April 28th from 5:30 to 7:30. And if they want more information, please contact me and I can get
Right
that.
on. Thanks, Julie. Anybody else?
Be doing a training tomorrow for the CU Anschutz rural medical program. That's a pretty cool program that gives all the providers that go through there will do their residency in rural Colorado communities. So it's just to kind of help them better connect to people in ag. So.
Oh, perfect. That sounds great.
Sarah, are you with us now?
I am, Robert. Thank you. When you promoted me to panelist, it had me log out and log back in. So I apologize.
Sorry about that.
Also, I share a fence with an elementary school recess yard. So if you hear children screaming, it's okay. They just do that all through recess. And so once I heard about the coffee break project through this working group, I think it was 2 working groups ago when you all shared, I just really wanted to establish something like that here in Larimer County. And I'm on the board of Larimer County Farmers Alliance, which is the county chapter of Rocky Mountain Farmers Union for Larimer County. And we don't have a lot of financial resources or a lot of people resources. So what we decided to do is we picked a coffee shop that we knew purchased from our local producers and also really focused on creating community just as a whole throughout Larimer County. And so that is the Fox Den, which is in northern Fort Collins. It's also near a brewery where we have a lot of success of attendance for our events. So we decided to just start with that and start with having it the first Monday of every month from noon to 1. As someone who's worked on vegetable farms and knowing that that's predominantly what we have with producers in Larimer County, I knew that Monday is probably the most flexible day for our producers. And so we just picked a time and date and decided to go with it. We've had one so far and we had 6 attendees, which was really wonderful. Agwell paid for
30 seconds, Sarah.
Okay.
Thank you. Keep going.
Oh, Agwell paid for our coffee. However, now that the RASP grant has been canceled through the federal government, we no longer have that funding. So at our next board meeting, which is this Wednesday, we're going to have to address that. But yeah, we are still going to keep it going and just figure it out. And if anyone has any suggestions for other funding for paying for coffee for attendees, that'd be great. I put my email in the Q&A. Feel free to reach out, anyone who's interested, who wants to just talk about it or has ideas for funding. Thank you.
Thanks, Sarah. All right, everybody, we passed our 2:30 mark, so I want to respect your time. Rosie will send a follow-up email in the coming week or so with links we talked about. Thanks so much to all of you that presented. I hope you all have a really good month, and we'll be in touch before the next meeting. Thank you.
See you, everybody. Take care.